Treatment of asbestos lung cancer, like any lung cancer, depends on the type of cancer present, small or non-small cell, and the stage it is reached. Small cell lung cancer is less common, accounting for approximately 20% of lung cancer cases diagnosed. It grows and spreads rapidly, dictating aggressive treatment. While its occurrence is most closely linked with smoking at this time, asbestos exposure increases its risk of developing. Non-small cell lung cancer, which tends to develop and spread much more slowly, is classified into three types: squamous carcinoma, cancer in the cells which line the lung airways; adenocarcinoma, cancer of the cells which produce mucus; and large cell carcinoma, which derives its name from the appearance of the abnormal cells under a microscope. Patients can have mixed histologies adenosquamous, mixed small and non-small cells. Traditional treatments for lung cancer include surgery, radiotherapy, and chemotherapy. Often, a combination of treatments is used. Newer treatments, such as photodynamic therapy and targeted biologic therapy, are coming into broader use. Under certain circumstances, participation in clinical trials is an option. For patients in whose stage 1 and 2 non-small cell lung cancer has been diagnosed, surgery is usually chosen as the first treatment, which can also be effective for some cases of stage 3 non-small cell lung cancer. The goal of these surgeries is to remove all of the cancer if possible. If performed early enough, before the cancer has spread outside the chest, surgery can cure the cancer by eliminating it from the body. Radiation is a potentially curative option in patients who are not candidates for surgery. Depending on the location and size of the non-small cell lung cancer, different types of surgery may be performed. A thoracoscopy, or video-assisted thoracic surgery, is minimally invasive, allowing the surgeon to access and remove the cancer through a small incision in the chest. If the cancer has spread within the lung, the surgeon may perform a wedge resection, removing a small section of the lung with the cancer. A segmentectomy, removing part of one lobe of a lung, or a lobectomy, removing an entire lung lobe. Lobectomy is the most common type of lung cancer surgery. In more advanced cases of non-small cell lung cancer, a pneumonectomy may be necessary, removing an entire lung. It is possible to preserve some of the lung tissue in some of these cases by performing a sleeve resection, in which the cancerous part of the airway affected is cut away, with or without adjoining lung tissue. Some patients will undergo chemo or radiotherapy prior to and or after surgery. This combination is becoming increasingly common as new data suggests a lower incidence of cancer recurrence and increased survival rate. In external radiation therapy or radiotherapy, strong X-rays or other types of radiation targets cancer cells to kill them. It is an important part of lung cancer treatment in all stages. A typical course of therapy involves 5 treatments per week for up to 6 to 8 weeks and can be used to shrink a tumor for ease of surgical removal, provide insurance against cancer recurrence. In cases where surgery is not possible because of the patient's age or physical condition, radiotherapy will be used as an alternative. In late-stage non-small cell lung cancer, radiation can be used as a palliative therapy, easing the discomfort of the terminal cancer. Internal radiation therapy can also be used, in which radioactive substances are placed near or directly into the cancer with needles, wires, or catheters. Radiotherapy is sometimes used in conjunction with chemotherapy apart from surgery, particularly in non-small cell lung cases, where the lymph nodes and lungs are the only cancerous sites and surgery is not an option. Small cell lung cancer is almost exclusively treated this way. The 2 therapies may be administered simultaneously or at separate times. Chemotherapy, in which strong cytotoxic medicines are administered, is given orally or intravenously and can help to control the growth and spread of cancer. It is standard treatment for lung cancer in most stages. Many different types of chemotherapy drugs are available and are often prescribed in combinations. Treatments are typically given once every 3 to 4 weeks for a period of at least 6 months and can either be systemic, where the drugs travel throughout the entire body, or targeted, where the drugs are injected directly into the cancerous area. Often used alone in late-stage cancer, chemotherapy can improve life quality and prolong the lives of stage 4 cancer patients. Whatever stage a patient's lung cancer has reached, treatment plans can be developed to suit their age, physical condition, and personal preferences. The key to the most successful treatments is early detection. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.